Hi, my name is Kiki Solano, and my evidence-based project proposal for this semester was based on decreasing skin injury amongst incontinent patients through the use of adhesive external urinary devices. So I worked very closely with the diabetes care team and the wound care team this semester, and this is the project that we found was going to have the most impact on patients through the hospital that was able to be implemented relatively quickly as well. Significance of the problem. So it is important to preserve patient function and reduce further decline while they are in the hospital receiving care. Improperly managed urinary incontinence can leave patients susceptible to incontinence-associated dermatitis, or IAD, and lead to longer hospital stays. It can also make them 5 times more likely to acquire sacral pressure injuries, according to a study by Kaiser et al. In 2021. Due to the dangers of catheter-acquired urinary tract infections, otherwise known as CAUTIs, many providers opt to use external urinary devices for incontinent patients, such as condom catheters and PureWick external catheters for females instead of indwelling catheters. However, the constricting nature of condom catheters can lead to skin irritation, ulceration, ischemia, gangrene, and penile necrosis. And a study done by Resnick in 2023 found that patients with PureWick catheters are less likely to move in bed or ambulate out of fear of dislodging the device, which is not a favorable result. So this leads us to the Peacock question. Just for a little bit of background, the PrimaFit and PrimaFit devices are the adhesive external urinary devices compared to the ones that are being used now, which are the condom catheters and PureWick female external catheters. I will show some pictures later in the slides for reference. But for the question, it's in incontinent hospitalized patients at risk for skin injury. Will the use of PrimaFit/PrimaFit devices decrease the occurrence of maceration and skin injury compared to non-adhesive external urinary devices over a 4-week period? So here are some examples of the condom catheters and PureWick catheters. So on the left is the condom catheter. It's very similar to a standard condom, except on the end of it, it has a port to be attached to a suction canister, so that as the patient urinates, it can be collected in the suction canister. The problem with these are that they only come in one size, and sometimes they can become easily dislodged or removed from the patient, or they can be too tight and cause skin injury, gangrene, penile necrosis, things like that. On the right is the PureWick external female catheter. So this also is attached to a suction canister at one end. It has a cloth portion in the middle, which is to be placed in between the female labia, and it collects urine that way. In gathering my research, the databases I used were Google Scholar, PubMed, and ProQuest, and the key terms used in my search were PureWick, wounds, incontinence, skin integrity, maceration, condom catheter, incontinence-associated dermatitis or IAD, adhesive external catheter, prevention, PrimaFit, and PrimaFit. So the evidence I gathered for this project consists of 2 case studies, 2 retrospective analyses, 2 qualitative studies, 2 systematic reviews, and 2 experimental studies. The researchers used patient samples from single facilities, patient outcomes from the Premier Healthcare database, and data from existing published studies from reputable academic databases. Patients included in the studies were those who were incontinent, obtained skin injuries related to incontinence, or patients who utilized external urinary devices such as condom catheters, PureWick devices, and PrimaFit/PrimaFit devices. Qualitative data was also obtained from nurses, physicians, and caregivers who worked with these patients. Interventions used in the studies were PureWick catheters, barrier creams, PrimaFit devices, and condom catheters. So studies by Kosel et al., Resnick, and Sinha et al. Found that utilization of condom catheters can lead to penile gangrene or penile strangulation. These studies also found that condom catheters and PureWick catheters can easily become dislodged and fail to manage incontinence, in addition to making the patient less mobile due to fear of dislodgement. There were some studies by Doty et al. And Kaiser et al. That concluded that incontinence-associated dermatitis can increase a patient's length of stay, and they're 5.7 times more likely to sustain a sacral pressure injury while hospitalized. The studies by Mugita et al. And Baker et al. Found that external urinary devices have proven to be effective at reducing IAD and reducing the need for catheters and improving patient comfort. There's limited studies on the PrimaFit/PrimaFit devices, but they were found to be effective at reducing incontinence-associated dermatitis and the need for urinary catheters as well. So an important finding that I came across in the literature review was that incontinence-associated dermatitis is linked with longer hospital stays. and this was in an article by Kaiser et al. In 2021. This is really important because the longer a patient is in the hospital, the more likely they are to acquire a hospital-acquired infection. This is going to increase their length of stay, increase their cost of their stay, and also increase the burden on the hospital for having the patient there longer than needed. Recommended best practice. So as we already know, the incontinence increases the risk of skin injury and maceration for our patients in the hospital if it's not properly managed. And then the studies found that external urinary devices such as condom catheters, PureWick catheters, and the PrimaFit/PrimaFit devices are effective alternatives to indwelling urinary catheters for managing incontinence and preventing caries. Limited research exists comparing PureWick catheters and condom catheters exclusively to the PrimaFit/PrimaFit devices, but the available evidence indicates that the PrimaFit and PrimaFit devices are preferred by patients and healthcare providers. At the facility I was working at this semester, we had an opportunity to implement this protocol, the PrimaFit and PrimaFit devices, on the ICU floor for a limited amount of time, and it was found that the PrimaFit and PrimaFit devices were actually very effective and reliable, even staying in place after a code situation. So these are the PrimaFit and PrimaFit devices. They're made by Sage Products. The PrimaFit is for the male anatomy. It has a customizable fit, no need for sizing tools. It stays in place, and the adhesive promotes easy application and removal, and it can be left in place for up to 24 hours, as compared to condom catheters, which need to be changed more frequently. For the PrimaFit, they're used for the female anatomy. It contours to anatomy and maintains shape for the duration of use. It stays in place and fits in the perineal area to secure the device in position, and it helps keep the skin dry with ultra soft fabric, which diverts urine away from the skin. So both of these devices have adhesive on them that can help them be kept in place, especially while the patient is moving, turning, or while nurses are performing their necessary nursing actions. Each of these devices is also connected to a suction canister to collect the urine in case it needs to be tracked for intake and output, or just to be sure that the devices are working as they're supposed to. So the policy that I created is this: all hospitalized adult incontinent patients at such facility unsuitable for continence training will be provided with PrimaFit or PrimaFit external catheters if appropriate. So if they're eligible for continence training, there's no reason why that they should be forced to use a PrimaFit or PrimaFit catheter. And the PrimaFit and PrimaFit devices are to be used for non-invasive external urine collection in patients requiring urine management. It's not suitable for patients who are experiencing urinary retention, those in the prone position, or to be used for stool collection. Caution should be used when applying to patients with altered mental status, of course, because it is attached to the suction canister, so it can place the patient at risk for fall if they're not aware of the catheter being in place. The rationale: poorly managed urinary incontinence increases vulnerability to skin injuries like incontinence-associated dermatitis, IAD, and sacral pressure injuries. Incontinence correlates with negative outcomes, including longer hospital stays and higher readmission rates, according to a study by Kaiser et al. In 2021. PrimaFit and PrimaFit devices aid early catheter removal to mitigate the risk for caries, and they offer an alternative to condom catheters and PureWick devices for addressing skin injury and reliability concerns. So for the protocol, these are the steps to be taken to actually implement use of this device. So the first thing is that it's important to explain the procedure to the patient and address any concerns to help reduce patient anxiety and just to make sure that they're informed about their care. Number two, ensure that the patient meets hospital requirement for urinary management tools prior to placing the device. As explained previously, if they're eligible for continence training, there is no need for use of these devices, and as well as being aware of any alterations in mental status. Number three, perform a skin assessment and document per hospital protocol as a means of evaluating their baseline as far as skin injury. Number four, decide whether the patient will need a PrimaFit or PrimaFit based on their genitalia and follow the manufacturer's guidelines for application. As I explained earlier, the PrimaFit is to be used for patients with a penis, and the PrimaFit is to be used for patients with a vagina. Number five, assess the PrimaFit and PrimaFit at least twice per shift, ensuring that it is secure and dry and that the suction chamber is functioning properly, and document appropriately. The devices are to be changed once every 24 hours. There will be a new charting feature in the hospital's computer system that allows the nurse to select how the patient's urinary incontinence is being managed, and it allows an option for them to select PrimaFit or PrimoFit. Number 6, report any skin injury related to the device or related to incontinence to the wound care team so that the change agent can come and evaluate each patient and document appropriately to provide data for this study. The implementation plan. To implement this change, clearance will first be obtained from the hospital materials supply team to obtain the new adhesive external urinary devices. Following approval, a representative from Sage Products, which is a company that makes the PrimaFit and PrimaFit devices, will come to perform in-services on each unit during day and night shifts over the course of a week, and this will ensure that all registered nurses are aware of the new product and how it works. In addition, there will be one nurse/change agent responsible for obtaining the proper teaching from the company about the devices, and they will be able to reinforce the teaching or answer questions from other nurses about the device. They will also be able to perform demonstrations and allow for return demonstrations from the nursing staff. This will help to ensure proper technique and will offer the RNs an opportunity to ask any additional questions. Informational handouts, posters, and word of mouth during huddles will also be used to disseminate this information to everybody on the nursing floor. It is also important to ensure supply rooms on each adult floor are regularly stocked with the PrimaFit and PrimaFit devices, and the wound care team will be involved since they will be collecting the data on any incontinence-related maceration linked with the use of any external urinary device. Lastly, there will be a designated change agent who will be responsible for collecting data and addressing concerns brought up by the staff, as well as enforcing any additional teaching or documentation needs. So the new adhesive external urinary devices, or the PrimaFit/PrimaFit devices, are being implemented with the main goal of reducing skin injury and residual moisture related to urinary incontinence. Secondary goals include reducing the need for urinary catheters while increasing patient comfort and satisfaction. There will be a feature added to the charting system for nurses to document which patients are utilizing the new devices and how frequently they're changed. With the use of this feature, the designated change agent will know which patients to assess for skin injury and which nurses to follow up with if they need any additional information. The change agent will gain feedback from the nurses and physicians who utilize the PrimaFit/PrimaFit devices with the use of anonymous surveys. The survey will ask about ease of use, application issues, excess moisture related to device failure, and professional opinions about the reliability of the products. Injury reports from wound care will be compared before and after implementation of the PrimaFit/PrimaFit devices to assess if the goals were met. The assigned change agent will then assess and compare the data about skin injury rates prior to implementation and redistribute the results to the hospital staff so that everybody is aware of the results of this study. So unfortunately, due to time constraints, I wasn't able to see this project through to completion, but we did make it through part of the implementation plan, and the devices are being utilized on the hospital floors now. Part of the data that has already been collected has shown that these devices are more reliable than the condom catheters and pureit catheters, at least in this facility. There are increased rates of patient comfort and satisfaction, as well as it being more cost effective for the hospital in terms of how frequently the devices need to be changed and how reliable they are. There's also increased satisfaction from the nurses and physicians about the reliability of the devices. Like I said earlier, there was a small case study done in the ICU about the reliability of these devices, and they seem to stay in place even after a code while turning and moving patients, and they were also effective at tracking urinary output. Thank you for listening to this presentation. Please contact me if you have any questions. And again, I'm going to have my references at the end of this presentation. Thank you. Most of the references used for this project were within 5 years, and they were all peer